Hi, I'm Jill Hutt, Vice President with the Greater Philadelphia Business Coalition on Health. We have a mission to drive innovation and value in healthcare for employers in the region, in Southeastern Pennsylvania, Southern New Jersey, and Delaware, by improving workforce and community health and healthcare delivery. We are very pleased to be partnering with Delaware Health and Social Services and the National Association of Chronic Disease Directors to raise awareness among employers throughout the state of Delaware about prediabetes, a major health issue and cost driver in the workforce, and offering a solution with the evidence-based National Diabetes Prevention Lifestyle Change Program. Prediabetes is certainly a growing workforce issue with serious health and cost consequences. Prediabetes is when your blood sugar level is higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. And an estimated 84 million American adults have prediabetes. That's more than 1 out of 3, and likely a significant number of your employees. 9 out of 10 people don't even know they have it. And now let's hear from Mike.
My name is Michael Jones. I'm a retired police officer. For the last 4.5 years, I've just been traveling and hanging loose. Well, when I was working at NYPD, it was very busy. You don't take care of yourself like you should. You would just eat whatever you could eat, whatever fast food, junk food in the vending machines. The only thing I knew about diabetes is that both my parents had it. My mother got it at her late 50s and my father got it in his early 60s. I never thought about it. I just thought, I'm young. I thought I was healthy. I was going to the doctor maybe once a year, and in the blood work, they test you for everything. It was a wake-up call, literally. I was asleep one day, the phone woke me up, and he made me aware that I had prediabetes. I immediately thought about my parents, watching my parents take needles every day, and I just said to myself, I couldn't do it.
How you doing?
So Michael, you have peanut butter. What is the serving size for the peanut butter?
The counselors in the program showed me that this was in reach for me to prevent. And they showed me the right things to eat. They showed me the right things to incorporate in my life.
Michael absorbed the whole program. And once you do that, you can see the results.
Well, we meet once a week. And we talk about what we do in our lives and what changes we've made. It gives you a sense of, camaraderie. You learn something new every time you go there. Basically, I just started shopping better. I cook my own food, baked chicken, grilled chicken, boiled potatoes, steamed broccoli. I make smoothies, a lot of fruits, vegetables, not too much red meat, chicken and turkey. You can use what's around you. I do calisthenics right here in my living room, or I'll just go outside and run around the park. Well, the motivation for me is, to watch my children grow and be here for them. And that starts with taking care of myself, my body. It may sound kind of dramatic, but it's like I'm running for my life. The results of my blood work for my A1C test are now close to normal. You really can reverse prediabetes. I'm proud to see how far I've come. I feel better, I feel stronger. I have a whole new life ahead of me. I plan to do a lot more traveling, try to hit every continent, and just live life to the fullest.
And when prediabetes turns into type 2 diabetes, it not only affects your employees' well-being, but also your company's bottom line. It is the costliest of the most common diseases in the country at $327 billion annually, and that includes both direct and indirect costs. The average medical expenditures are 2.3 times higher for people with diabetes than those without diabetes. And people with type 2 diabetes are at higher risk of serious health complications, including kidney failure, blindness, heart attack, stroke, and loss of limb. And as shown on this pictorial, diabetes prevalence in the United States has grown at alarming rates since 2004, from 7% to 33% in 2016. And here in Delaware, diabetes prevalence is increasing, rising from 8% in 2003 to 12% in 2020. 9% of Delaware adults have prediabetes. And of note, 37% of Delaware adults are obese, and an additional 32% are overweight, conditions that increase the chances of developing type 2 diabetes. Diabetes is prevalent among the races and more prevalent in Blacks than whites and Hispanics. Prediabetes and diabetes annual costs combined in Delaware are at an alarming level of $1.1 billion. And COVID-19 has a greater impact on individuals with type 2 diabetes, manifesting in more complications, more hospitalizations, and death. So it's clear, unless they make lifestyle changes, many people with prediabetes will develop type 2 diabetes within a few years. And if we do nothing, by 2050, 1 in 3 adults in the United States could have diabetes. And that is your current and your future workforce. Luckily, there is a solution, and that is with the National Diabetes Prevention Lifestyle Change Program, the National DPP. And the program works. Research shows that a structured lifestyle change program like this one, that includes losing 5 to 7% of body weight by eating healthy and increasing physical activity, reduces the risk of developing type 2 diabetes by 58% in people age 60 and under, and by 70% in people over age 60. And even after 10 years, those who participated in the lifestyle change program had a 34% lower rate of developing type 2 diabetes. The program is led by a trained lifestyle coach using a CDC-approved and evidence-based curriculum. It offers a full year of support with weekly and monthly sessions. And importantly, it is available both in person and online. It is cost-effective at just an average of $500 per person. And offering the national DPP is effective for employers. By just investing an average of $500 per person, you can avoid an increase in $8,000 in medical expenditures over a 3-year period. And you can achieve value on your investment with increased employee productivity, engagement and retention, and decreased absenteeism and presenteeism. Now let's hear from 2 Delaware employers about their experience in offering the National Diabetes Prevention Lifestyle Change Program. I'd like to introduce Donnie Bourgeois-Smith, Employee Benefits Manager from the City of Wilmington.
In 2017, there was a piece of data out there that said that only 26% of our workforce had been to an annual physical. And with the data that we did have, it was really clear to us that the city had not only a prediabetes problem, but also a diabetes problem. And it became an important part of our preventative health strategy to double down, to refocus our efforts on seeing what we could do to help address prediabetes as a chronic condition. The program, when we rolled it out, was extremely well received. One of the key things that we did is we offered it on site with the full understanding that the diabetes prevention program is offered in great locations throughout the state. We felt it was important to assist people to get well at work. We had tremendous support from our mayor, our chief of staff, and our director of HR, who immediately saw the benefit of having a diabetes prevention program of this nature on site. We always say COVID slowed us down, but it didn't stop us. I was really proud of our employees and how they were able to pivot into the new platform to go 100% virtual. From a financial perspective, as a benefits manager, the return on investment is easy. For an average cost of $420 per participant, the city was saving approximately $2,500 per person. So given the level of activity we had in our first session, that amounts to over $150,000 in savings for us. I have such great stories from our employees as to the impact participating in the program had on them. I have an employee who stopped me and said, I would be willing to share my story with others who might be interested in participating. The diabetes prevention program literally changed my life. And I have a lot of other working professionals that say that their entire family got healthier because they were participating. But I would say that there's an intangible return on investment that I think we will see in our future financial outcomes, which is that the number of people that we prevented from actually developing into type 2 diabetes and the expense of that, the number of people we prevented from stroke, heart attack, high blood pressure, and the knock-on effects of that. So while we're excited to talk about 150,000 in initial savings, we believe that our participation at this level in the diabetes prevention program is truly immeasurable. So again, as I say, it's low effort, high return, just to let people know and to help them get engaged and to be accountable for their health and wellness through participating in the program that is the National Diabetes Prevention Program.
And now I would like to introduce Aaron Schrader, Human Resources Manager of the Statewide Benefits Office from the State of Delaware Department of Human Resources.
As the State Employee Benefits Committee's administrative arm, the office I work in, the Statewide Benefits Office, is responsible for the strategic planning, administration, and financial management of all health and related benefit programs available to eligible group health insurance plan members. Diabetes is the leading cost driver considering clinical conditions by episodes of care among state of Delaware group health insurance plan members. Members with diabetes have higher rates of utilization than their respective cohort for hospital admissions, hospital readmissions, ER visits, and prescriptions. Research shows us that people can prevent or delay type 2 diabetes with lifestyle changes, such as losing a small amount of weight and getting more physically active. Diabetes prevention and management is an area of focus in the Group Health Insurance Plan strategic framework. One of the goals in the framework is to reduce group health insurance plan diabetes costs over time by doing things such as continuing to offer programs like the National Diabetes Prevention Program and increasing awareness and engagement in these initiatives. Participation in the National Diabetes Prevention Program is a 100% covered preventive care benefit, meaning no costs for members enrolled in the State of Delaware Health Plan. Now, the State of Delaware has two health plan vendors, Highmark Delaware and Aetna, to offer State of Delaware plan members the choice of participating in the National Diabetes Prevention Program via an in-person on-site option or an online virtual option. Now, our office, the Statewide Benefits Office, uses various modes of communication to educate our group health insurance plan members about the National Diabetes Prevention Program, including print like posters and postcards. Online, we have links on our website and we send numerous emails, and on-site as well as virtual information sessions. From fiscal year 2018 through fiscal year 2020, enrollment in the National Diabetes Prevention Program steadily increased among group health insurance plan members. 272 members enrolled through either the Livongo DPP or the YMCA program. Subsequent diabetes diagnoses among group health insurance plan members who enrolled in the National Diabetes Prevention Program from fiscal year 2018 to fiscal year 2020, 22.1%, which was lower compared to a reference group of members with prediabetes at 24.3%. In addition, among group health insurance plan members who participated in the National Diabetes Prevention Program through the YMCA, 49% achieved a 5% weight loss, and on average, members attended 80% of National Diabetes Prevention Program sessions and participated in 134 minutes of physical activity per week. Since the state of Delaware has offered the National Diabetes Prevention Program for several years now, you might be wondering, what are some of the lessons learned? One, be sure to use multiple modes of communication, both print and online, throughout the year to increase awareness and engagement in the program. 2, promote the National Diabetes Prevention Program as a healthy living or lifestyle change program to lessen the stigma of the term diabetes. Employees don't have to have prediabetes to be eligible for the program. For example, they could meet eligibility criteria by having a qualifying risk score when looking at family history and age. We promote it as the National Diabetes Prevention Program, but we also include in our communications, it's a way for participants to eat healthier, increase physical activity, lose weight, overcome stress, boost energy, and reduce their risk of chronic conditions, including type 2 diabetes. Thirdly, offer incentives to participants, such as free gym memberships or a wireless scale or activity tracker. Sometimes promoting the health benefits of programs is just not enough. People like incentives and giveaways. And for me, one of the best things to see for the program are the success stories, as members share how the program has impacted their life. I want to share just a few sentences from a State of Delaware employee who shared their success and their story from the YMCA Diabetes Prevention Program. This employee reported, "I've lost over 30 pounds since March. I'm exercising almost regularly, and I'm started to make healthier food choices with better portion control. I feel more energetic, and my chronic back pain is gone."
And now let's hear about the YMCA of Delaware National DPP program.
The YMCA's Diabetes Prevention Program is a year-long program. Our topics are on healthy eating, becoming physically active. It's support for one another. So that motivation helps them to lose weight so that they're no longer pre-diabetic.
With the tremendous increase in the number of type 2 diabetes in the country and across the world, there's now a renewed focus on how to prevent that initial transition. So several years ago, different societies came out and identified that as a discrete stage or condition that we now call prediabetes.
I feel very positive about the changes that I'm making in my life because I'm doing something about it. I'm not just bemoaning the fact that, my diabetes is in my family. I'd like to be lighter. I'd like to be more fit. I'm doing something about it. And that's a really positive feeling.
Since the start of the program, I have lost 15 pounds. I feel healthier. I'm sleeping a lot better. Probably for the first time following a plan that I'm not hungry.
I've lost 14 pounds. I have been struggling with my weight for years, and I just had gotten to the point where I just didn't think I was going to lose weight anymore. So it's just been great. It really has been great for me.
I feel healthy. I did lose quite a bit of weight through the process. Eating the right food and exercising made all the difference in the world for me.
The YMCA Diabetes Prevention Program is common sense, lecture-based, not a diet, simply a change in diet and lifestyle with access to exercise that lasts. So it's just a different approach as opposed to a diet. It is absolutely patient-driven, patient education, and lifestyle changes.
So how can you help your employees address prediabetes and prevent or delay type 2 diabetes? Talk with your health plan and benefits consultant to identify the national DPP programs that are covered as a medical or a preventive benefit. And please note that the health plans here in Delaware do have this available both online and in person. You can use the CDC cost calculator with your own data to estimate your return on investment in offering this program. And we're here to support you in offering it, promoting it, and measuring your results. We have available many turnkey educational tools and resources to support you, including those from the National Association of Chronic Disease Directors and from Quality Insights. So I urge you, work with your partners to implement the National Diabetes Prevention Lifestyle Change Program. Take action now to prevent diabetes in your workforce, which will reduce costs and increase healthcare value for your organization and the community now and into the future.